Yes. So my name is Flavio Uribe, and I'm originally from Medellin, Colombia, and I've been now in the University of Connecticut over almost 30 years. My dad was an orthodontist from University of Iowa, and growing up watching him, it was inspiration of what he did for the patients and how proud and how happy every night he was from what he did. And so I would say from second grade in my education, elementary school, I said I want to be an orthodontist, and this is where I am. Orthodontics is my life. It's my passion. It's been what I enjoy the most. It's what I often read about, and it has centered, I would say, my not only my professional life but my personal life around orthodontics and what we do and what we teach and what we learn and the future. All those things that are pretty exciting about orthodontics. I believe society plays I would say in the whole world and I would say maybe especially in the United States, a big value to what straight teeth mean and having a good aesthetic. So overall, I think society puts a high value to orthodontics and feels that I would say every parent would want to give their kids and even for themselves want to have straight teeth, and you can see it many times that they would have orthodontic treatment as a child and they come back because some teeth have like not are not aligned perfectly back again, and they sometimes even three times go for treatment. So definitely there's a society that plays a big value to aesthetics and what orthodontics can do for that part of psychosocial well-being for patients. I mean, a couple of things. One, that what I just mentioned, that my dad was an orthodontist from the University of Iowa, and he practices. He actually came here for the residency directly from Colombia without knowing any English. He learned English and then did the residency in the University of Iowa, and then he went back to Colombia and practiced his whole life. One of the first orthodontists, I would say, in the country, and he was very proud and very happy with his whole life. He practiced until he was about 75. When he started shaking a little bit, he couldn't practice anymore. So and interestingly, he kind of like always put bands around the teeth, and he stayed not too, I would say, current with the new techniques, but like, I mean, it worked for him for the longest time. So that's one thing. And the other one that I think I'm very proud is that maybe some people know that I like to do triathlons, and actually I'm signed up for one half Ironman in September in Augusta, Georgia, and I think one of the related to that, one of the most proud moments is that I broke that 3 hour marathon, like that milestone, under 3 hours in Houston before I was 40. So like just before 40, I turned 40, 39. I cut it below 3 hours. So that's, I think, one of the things that I'm very proud of overall, and that maybe it's not many people know about. To me, in orthodontics, I think patients with missing teeth and I would say kids with oligodontia. I think that's one of the things that I consider that it's a problem from in two aspects. One, difficult to manage orthodontically if we can manage it orthodontically. And I think the second problem, more important of all, that we actually face it in the university, is that these kids, nobody wants to restore. So like they want to probably leave the restoration to when they're 18, and sometimes that means like taking all the teeth out because there's few teeth. So there's not a good way to approach these patients in their younger years, because like it seems that nobody wants to take care of them. Like so I think that to me is one of the most difficult problems that we have. They're not too many, but we do get them in the university, and then again, it's just something that I think I would say needs attention here in the U.S. because I don't think they have a good solution, and I think orthodontics could really help these people, but certainly it's complex, and more importantly, if you don't have somebody at the end that is going to grab that baton after you finish, um, that becomes even more difficult. So I think that's, I would say, the most challenging patients that we have. I think definitely you can say deep bites, open bites, all these malocclusions that like typically are complicated, but I would say certainly people with missing teeth makes orthodontics much more difficult. No wonder digital dentistry. Yeah, digital dentistry. I would say from Invisalign. I remember coming in 1999, Invisalign coming into the market. I'm like, this is really going to work, and here we are. And I think related to that is also orthodontic surgery. Like how I trained in orthodontic surgery was a big revolution. I would say 10, 15 years ago, like when we started doing the virtual surgical planning. It was what a change, being able to see things in 3 dimensions in the planning, I think was a big change. Incidentally, from historically, I think the 3D planning aspect of things has been always, I would say, in the education component of in UConn, like from Dr. Burston, always thinking about how we can do planning in 3D, and that's kind of like you would see occlusograms that we learned and were developed like in the 60s and not very popular with the residents because there was a lot of work that needed to be done with those occlusograms kind of like in 3D and it was a kind of like an archaic way to do things. But I think now with the digital planning, like the claim check made like, like this almost have to do treatment planning, like this 3D visualization of our goals. So I stress that a lot to our residents that like that we used to do that. This in paper, cutting the paper, taking picture of the model, like it was very cumbersome, and to be able to visualize what we wanted to do. But now with this digital dentistry, it's just such a big change, and but also important because like the still like what you see on the digital plan is not what you're gonna get, because there's also the mechanics component to it. So in biology, that I think that's just something that we in the profession need to understand better if we're going to evolve and do things maybe a little bit different in the future. So so I think orthodontics has changed some, but I don't think too drastically in the last 100 years. So I think that's where probably the future is, and but I'm not too sure. Like we have like a lot of like right now seeing like a path in that direction. I think definitely biology is the one, but like not sure which angle is it that we're going to go to really reach that goal of like somehow modulating biology to be able to maybe accomplish things that we cannot accomplish, or one thing that is kind of like I think the dream of many orthodontists, make treatment faster. I would say I think the ratio of clear aligners versus fixed appliances. I think that I'm very intrigued, like how that's going to play out. Like if our kids going to be more aligners in the next 10 years than fixed appliances, and I think that's the uncertainty. And but I do definitely believe that that we're going to move in that direction more. That the ratio is going to become more aligner based, and I think that's what, like, I think in the next 10 years, probably we'll see. But I don't foresee like in terms of biology that I think that's what really could make the difference. I'm not too sure if we're going to see a major change there. Like if we're going to start giving some biological intervention to be able to do things that like like the magic, like moving a tooth in a day or something like that, like that very magical. I'm not too sure if that's in our future really close. But anyway, I think that's something that like I remember like as a student I was studying, like if you could just kind of like dissolve the bone and then move the teeth into the right place and then fix them, like I think that's something that like that I was kind of like envisioned, but I don't know, like it's I don't think it's near yet, but who knows, maybe 20 years, 50 years. So Dr. Anda's my mentor. He early on told me, like let's just submit some of the. Early on I started like doing cases a little bit differently. If I could describe myself, I kind of like try to do things differently in orthodontics, kind of like to see how much you can kind of like get around with different approaches. And so he kind of like started probably noticing that from me, and then said like, like just start writing these cases and presenting this to the whole world through the lens of the JCO. And so I started writing articles with him for the case report, and I still do, and I still involve the residents. And like I think it's a pretty kind of like cool thing to show what we do here and how we think about orthodontics and how pretty much mechanics can be applied, and teach about mechanics to from a UConn perspective to the whole world. So Dr. Anda really was the one who got me involved, and since then I've been involved with the JCO for like over, I would say, 20-something, 5 years maybe. Yeah, maybe 20-something years, 23, 22 years. Yeah. I think it's just a source of clinical information for what people are doing all over the world. I think it's a community of clinical orthodontics around the world. I think you would see a lot of the emerging technologies historically coming from JCO as a case report or as a case series. And I think it's just a way to see like what people are doing currently. Sometimes seeing what like they're lecturing on, then looking in detail what really things that you maybe have missed during the lecture that might be prompting them to do things a certain way. So I think it's a big resource and significant amount of information that's stored in the JCO historically and currently of what's going on and what's could be even the future of orthodontics, of clinical orthodontics overall. And I think also to know like what's the orthodontics that are up and coming, the ones that are more recognized, like see what people are doing, and sometimes like get like little pearls that you can apply to your practice, and also develop a new pearl that is an offset or offshoot of that pearl that you learn from another orthodontist. I think pretty much similar like what I think described for myself. I think JCO, I would say, is a long-standing journal of clinical orthodontics. So I think I always hear, like that, there's a lot of journals and of course, but I think the clinician definitely wants to see images, definitely wants to see, like this looks like my case, and looks like like I could apply this or that. So I think it's just an easy journal to visual journal that can be used by many clinicians to see what's going on and see new approaches, and also see, like who's also publishing, who's the clinical pearls, who's coming up with new things, and I think being current, like this whole thing about lifelong learning, I think also comes from JCO, trying to kind of like bring new approaches and techniques into the clinicians so they can be aware of and learn about them. So certainly a wealth of knowledge to be useful for the clinical practice and for knowledge also. I think at the end is like JCO has a process that is a peer review process, so that kind of like from that perspective, you have that layer of let me look at this evidence and see what they're presenting, if that makes sense, if it does really kind of like is it like fake or not fake, like that, like can this really be done, does it have a logical biological basis or mechanical basis if it's an appliance. So there's a vetting process basically for that information that you're reading. So that's an important piece of it, and certainly I think you have to be aware that sometimes social media, maybe there might be some misinformation. So I think that's kind of like that tricky part of like picking up what's like really what could really be true or not, and so I think that JCO does have that weighting of like of some experts, some like that peer review process that it certainly can make that more valid overall compared to social media. But anyway, I kind of like I'm not a big social media person, so I'm kind of like not the best to ask about that because like I just don't follow it. And we try our residents to like not tell them not to look, but like to be aware of exactly this what I'm describing. Definitely a lot of like of clinical pearls and things that I kind of like maybe not have seen before or I'm hearing from the first time. Like like I have like like I don't know if it's a video, but like it's kind of like my stack on my desk. It's kind of like like here are like all the issues here that like that I keep always like like I always have the archive, but I also have like the new issues coming in. And even though I'm not have time to like read everything. I just kind of like quickly glance over and see what what captures my eye. So like certainly it's been over the years like a big source of inspiration too. Like like I would say like that. I don't think I have created anything new, but like I definitely have like taking some ideas and it's kind of like art. I would say like if I just kind of like you see what other artists are doing and you kind of like try to put in your own and like and see how you can create with what other people have done. So like so I think JCO has been a lot of that for me in my career too. I think it's just like maybe a little bit repetitive, but like for all these reasons I described above, is like a way to see what's new information, new clinical pearls, who's up and coming, who's really publishing in the journal that like might be worth seeing or listening to, and also like new technologies like and even old technologies and like or even the practice survey that it's been put out. I think is a wealth of information for the practicing clinician, knowing what are the trends. I believe it's 7 years that he produced that, like so that information kind of like as how the orthodontic practice evolves through the years. So like there's a lot from a business perspective, from a clinical perspective. So I think it hits that practicing orthodontist in really the important parts that are for them. And I think it's always been kind of like really trying to involve the or very in I would say concerned or like really mindful of the clinician out there and like trying to kind of get the feel of like what their people are thinking, what they want, and trying to kind of like address those needs and wants of the orthodontic community. I think more that I would say that like there's many I mean definitely we hear that there's many ways to do things in orthodontics and that's for sure, but there's like not a perfect answer, like I think there's always our evidence is okay, could definitely be better. So it's always kind of like I think as I age, it's pretty striking to me the way that orthodontists how they approach to a problem so differently. Like there was one meeting that we were like in the speaker was had like those interactive polls that like that people pick like like what would you do for this patient? And I was so shocked that like 30% would pick surgery, 30% would do treatment like this, 30% like it was kind of like all over the place. And I'm like that there's no agreement on many things that we do. So I think I would say that like that like as you graduate from your residency you think there's one way or you can like have your recipe in your mind, but like I don't think there's something like that. Like there's too many ways and you keep learning. And something that I did learn from Dr. Burston, I never forget, Dr. Burston used to say the day I figure out orthodontics, I'll go in private practice. And, and like it was his whole life in academics. So anyway, I think that's what I like about academics, that like we're trying to kind of like see how we can understand things better. And certainly orthodontics brings a challenge with biology, that biology sometimes is very uncertain. Long life learning. I think that there's always, I mean, I think maybe something that pushed me into academics was like seeing my dad stagnant and like putting bands like for his whole life and not evolving. I think you have to be always evolving, and so I think you have to kind of like always pick what's going on and what's new in the radar. And like we're always kind of like in that. in that mode here in the residency, and what we teach the residents, and again what we try to kind of like present when we present our lectures, national and international. It's like, like there's new ways that you could do things, maybe more efficiently, more effectively, and so that kind of comes along with like not staying static. I think something I think I've learned also here in academia, you have to move, even sometimes in the wrong direction, but you have to move. Like that's kind of like my advice. There's no cookbook. Like there's like I think the best advice when they start, I tell them, like just get lost and read a lot. Like you have to read and make your like get lost in that forest of knowledge, and then eventually come out with after that with some sort of like key concepts and but nothing set in stone. Definitely like try to learn as much as possible, and then like that there's no cookbook, and don't try to look for that cookbook. I think that's kind of like the most important lesson, I think, for them, because like everybody's kind of like wants to like kind of like learn something that like will be easy and applicable to everybody, and it doesn't exist. So to me, I think it seems to be like as you age now, and like you go like more than the older than younger side, you kind of like think about what thing like you want to teach people that like that maybe it's not commonly done. And I would say related to this multidisciplinary play patients, I think the ridge mini screw is a screw that we put on the ridge, almost like an implant. I think it's such a powerful tool that we can use for these dental spaces to control a lot of the side effects, and do a lot of I would say almost magical things with those mini screws that like would be very difficult to do without them. So I think that my best pearl, I think, is just using that ridge mini screws for edentulous sites, like to move teeth around those mini implants. So that's, I would say, my best pearl. Yeah.